My name is Brittany Rose, and I'm a student at Bluefield State's Bachelor of Nursing program. Today I'm going to talk to you about STDs, which is sexually transmitted diseases. And I'm really going to focus on the teenage population. What are sexually transmitted diseases? STDs are diseases that pass from one person to another through sexual contact. That can be vaginal, anal, or oral. These include chlamydia, gonorrhea, the human papillomavirus, also known as HPV, syphilis, and HIV and AIDS. And most of your local clinics and doctor's offices do offer these pamphlets if you are interested in the information. How are STDs spread? You can get an STD by having vaginal and or oral sex with someone who has an STD. Anyone who is sexually active can get an STD. You don't even have to go all the way, which is having oral or vaginal sex, to get an STD. This is because some STDs like herpes and HPV are spread by skin-to-skin contact. How common are STDs? STDs are common especially among young people. There are about 20 million new cases of STDs each year in the United States. About half of these infections are in people between the ages of 15 and 24. Young people are at greater risk of getting an STD for several reasons. Young women's bodies are biologically more prone to STDs. Some young people do not get the recommended STD testing. Many young people are hesitant to talk openly and honestly with a doctor or nurse about their sex lives. Not having insurance or transportation can make it more difficult for young people to access STD testing. And some young people have more than one sex partner. What can you do to protect yourself? The safest way is abstinence. That means even if you have a steady boyfriend, girlfriend, do not have sex. You make a pact, and they have promise rings to show a promise to each other that they will stay true and not have sexual contact with each other or anyone else. Also, you can have a mutual monogamy, which means that you and your partner both agree to have just each other as sexual partners. Okay, also you can use condoms. But, especially in the younger generation, they don't want to do that. The hormones, they don't care, and they don't think decisions through. Also, I want to talk to you about, as a parent, things you can do. You need to talk to your teens. Let them know that they'll be experiencing different changes with their body for puberty. Let them know your expectations for dating and contraception and condom use. How to avoid teen pregnancy, STDs, and HIV and AIDS. And how to have healthy relationships. You also want to be clear and specific about family values and rules, and about when it's okay to start dating and your expectations about dating and sexual behavior. Believe in your power to affect change. It might seem like your son or daughter is ignoring you, as if your adolescent doesn't want to hear what you have to say, or they don't care what you think. Despite how they act, some of what you say will sink in. In survey after survey, children report that they want to talk to their parents about their sex-related questions, but they're just too embarrassed. Be there. Monitor them. Supervise them. Let them know that you care. Children that feel like they have a parent there watching them will be more prone to not want to engage in sexual activities if they've got that parent there interacting with them. Also, discourage early dating. Dating during adolescence is common and can be a part of healthy development. However, serious and exclusive dating relationships can lead to adolescents that have sex earlier than they would have otherwise. Ensure your child has regular visits with a medical provider. And talk about their future. Let them know how important it is to get an education, how proud of them you are. Let them have that encouragement. Also, another thing I want to talk to you about is there are different programs for prevention. One is Space Monkey. It's an STD prevention allocation consequences estimator, and it calculates how common STDs are in the population. Another thing we can talk about is vaccinations. Even though most of them do not offer vaccinations, the one that does is your HPV, which is your human papillomavirus. And as a parent, this is something we all need to think of, because where is it found? It is found on skin surfaces. There are more than 100 types of HPV. About 40 types of HPV can be passed during sex. This makes HPV a sexually transmitted disease. How do you get it? It's passed during sex. It's that skin-to-skin contact. Anyone who has sex can get HPV. HPV can be passed during vaginal and anal sex, and sometimes genital touching. It can also be passed during oral sex, but this is rare. HPV is easy to pass because it's so common and because people can have it without even knowing it. HPV is very serious. You need to know the consequences behind having unprotected or early sex. Also, since we are talking about HPV, I'd also like to talk to you about the relation of HPV to breast cancer. Even though right now it's controversial, in the younger generation, they still need to understand how to do a self-breast exam and what signs to expect. So I have a model breast tissue, and what you need to do first off is you need to begin by looking at your breast in the mirror with your shoulders straight up and your arms to your hip. Look for any change. Even the smallest changes could mean a problem. That's such things as changes in breast shape or size, a lump or thickening in the breast or underarm area, inverted nipple. When you're doing this, make sure you do not see any signs of that. If you do, contact your healthcare provider. Now raise your arms and look for the same changes. Okay, while you're at the mirror, look for any signs of fluid coming out of one or both nipples, which would be nipple discharge, which can be blood, or a milky look, or even a clear solution. Look for changes in the skin or look of the breast nipple or areola, dimpling or puckering, scaly redness or swelling. Next, feel your breast while lying down. Well, I kind of improvise because I can't lay down right here. But you take, and if you're inspecting your left breast, you take this hand and feel over. You need to move in a circular motion about a quarter size length all the way around. Feel for any lumps. And in this model, it does have multiple little nodules in it to let you feel how it should actually feel, what's normal and what's abnormal. As you go circular all the way out, you also include your underarm area and make sure you include the lymph nodes. Finally, feel your breast while you're standing or sitting. This self-breast exam can best be done 4 to 7 days after your menstrual period and while you're in the shower because everything's loose and wet. But I hope the information I gave you about STDs gave you some knowledge about how important it is to talk to your teens. Talk to anybody you know that is having sexual intercourse unprotected. Know the signs. know what can happen.